Why do raw patients need a DEXA scan? Have you ever wondered why patients with rheumatoid arthritis might need a DEXA scan? Understanding this can help shed light on the connection between rheumatoid arthritis and bone health. Patients with rheumatoid arthritis face a higher risk of developing osteoporosis, a condition that weakens bones and makes them more prone to fractures. This risk is influenced by several factors related to the disease itself and its treatment. Rheumatoid arthritis is a chronic inflammatory condition that affects not just the joints but also has systemic effects on the body. One significant consequence of this inflammation is bone loss. Additionally, many patients are prescribed glucocorticoids, which are steroids used to manage inflammation. While these medications can be effective for controlling symptoms, they can also lead to decreased bone density. This means that even younger patients, often between the ages of 30 and 50, may experience bone loss earlier than what is typical for age-related osteoporosis. A DEXA scan, or dual energy X-ray absorptiometry scan, is a non-invasive and quick test that measures bone mineral density. It uses low-dose X-rays to assess the strength of bones, focusing primarily on the lumbar spine and hips. For patients with rheumatoid arthritis, a DEXA scan serves several important purposes. Firstly, it can diagnose osteoporosis or osteopenia, which is a condition of low bone mass that may develop as a complication of rheumatoid arthritis. Secondly, the scan helps predict the risk of fractures. Patients with rheumatoid arthritis are more likely to experience fractures due to the fragility of their bones and the increased risk of falls caused by joint damage and muscle weakness. Monitoring bone density over time is another critical aspect. This is particularly important for those on glucocorticoids, as these medications can worsen bone loss. Furthermore, the results from a DEXA scan can guide treatment decisions. If osteoporosis is detected, healthcare providers may recommend starting medications to strengthen bones or suggest lifestyle changes to help prevent fractures. In some cases, a DEXA scan may also include a vertebral fracture assessment. This can identify fractures that may not yet be causing symptoms but indicate significant bone weakening. In summary, DEXA scans are essential for patients with rheumatoid arthritis. They help detect and monitor osteoporosis, reduce fracture risk, and ultimately improve long-term health outcomes. This is a vital part of managing rheumatoid arthritis alongside controlling joint inflammation and addressing other systemic effects. Always consult with healthcare professionals for personalized advice on when and how often to have a DEXA scan based on individual risk factors and treatment plans.